Arjun. I'm going to tell you about our brain-computer interface, the SeizeFreeze. This is an EEG strip of what seizure activity looks like. Think of it as an overwhelming electrical storm. Now, our technique is based on an observation neurosurgeons made. When you quench or irrigate hot brain tissue with ice-cold saline or Ringer's lactate, you return to baseline. You're halting seizures immediately. It's a technique called vocal cooling. 24 follow-up studies confirm that vocal cooling works. And I use these findings, plus input from neurosurgeons and patients, to design and patent SeizeFreeze. It consists of two parts: the cortical unit, the business end, that interfaces directly with the brain, and the controller plus battery that's going to be clavicle mounted. The cortical unit has three main layers. First, we have our detection layer. Think of it as EEG, but inside the skull, so we know exactly when to turn our cooling mechanism on. This layer is in direct contact with the brain, so it'll be engineered for maximum biocompatibility and for long-term implantation. It's based on state-of-the-art methods I've learned in Pitt, such as using platinum-coated electrodes and a substrate made of polyamide. Here is where we perform thermal neuromodulation. The seizure is detected, our Peltier thermoelectric cooler is activated. This is very reliable tech that NASA uses in space shuttles to chill water without moving parts. It's an active circuit element that allows current to go through NP junctions in series to produce a thermal gradient in parallel. In other words, it'll take in electricity and convert it into coldness on one side and heat on the other. While one side of the Peltier device is cooling down the brain to alleviate the seizures, the other side is heating up. So on the hot side of the Peltier chip, we have a heat exchange complex. It first consists of a sink to collect and funnel the waste heat. It'll be made of a copper wire mesh and encapsulated in medical-grade silicone. The heat sink then tapers into a heat pipe. The heat pipe will contain a working fluid that will absorb any latent heat from the Peltier chip instead of radiating externally. This will prevent local heating from harming the patient. I've identified the suppliers so I can assemble the MVP and we can begin preclinical testing on organoids in animals. Join me in moving this from concept to reality so we can impact millions around the world with epilepsy.